Hello everyone, welcome to our channel, where we dive deep into topics that matter. Today, we're exploring mild autism, also known as Level 1 Autism Spectrum Disorder. This is a topic close to many hearts, yet it's often misunderstood. What does it mean to live with mild autism? How does it shape daily life, relationships, and personal growth? Buckle up for an eye-opening journey as we uncover the nuances, challenges, and strengths of mild autism. By the end, you'll have a clearer picture of this condition and how it impacts millions worldwide. Let's get started. Mild autism, or Level 1 Autism Spectrum Disorder, refers to individuals with autistic traits who require minimal support to navigate daily life. According to Verywell Health, it's often called high-functioning autism, though this term can oversimplify the experience. People with mild autism typically have no significant delays in language or cognitive development. They might excel academically or professionally, but social and communication challenges persist. Imagine someone who's brilliant at solving complex problems but struggles to pick up on sarcasm or maintain small talk. These subtle differences make mild autism unique. It's not about being less autistic, but about having lower support needs compared to levels 2 or 3. Autism is a spectrum, meaning it varies widely in presentation. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, categorizes autism into 3 levels based on support needs. Level 1, or mild autism, involves challenges in social communication and behavior, but with greater independence. For context, Level 2 requires moderate support, while Level 3 involves significant assistance, often for daily tasks. The spectrum concept recognizes that no two autistic individuals are alike. Some might struggle with sensory sensitivities, like loud noises, while others hyper-focus on specific interests, like trains or coding. This diversity is what makes autism so fascinating and complex. So, what does mild autism look like? Socially, individuals might find it hard to initiate conversations or read nonverbal cues, like body language or tone. They may appear disinterested in social interactions, not because they don't care, but because decoding social norms feels like solving a puzzle. Communication challenges include difficulty with figurative language. Think idioms like, "It's raining cats and dogs," repetitive behaviors, or stimming, like hand flapping or rocking, help with self-regulation. Sensory sensitivities are common too. Bright lights or certain textures might feel overwhelming. These traits vary, and many learn to mask them, especially females, which can delay diagnosis. Diagnosing mild autism isn't straightforward. Because symptoms are subtle, they're often mistaken for shyness or other conditions like ADHD. Verywell Health notes the diagnosis may not occur until adolescence or adulthood, particularly for females who are adept at masking. The process involves a multidisciplinary team, psychologists, neurologists, speech therapists, and more. They analyze developmental history, behavior, and use tools like the Modified Checklist for Autism in Toddlers, MCHAT-RF, for young children. For adults, questionnaires like the Social Responsiveness Scale help identify traits. A diagnosis of Level 1 autism confirms mild challenges but opens doors to tailored support. Mild autism isn't just about challenges. It's about strengths, too. Many individuals have exceptional attention to detail, making them excel in fields like engineering, art, or research. Their intense focus on specific interests can lead to remarkable expertise. Think of someone who knows every detail about World War II aircraft or can spot errors in code that others miss. They often approach problems with unique perspectives, offering creative solutions. Honesty and loyalty are common traits, fostering deep, meaningful relationships when given the right environment. These strengths remind us that autism isn't a deficit, it's a different way of experiencing the world. Despite their strengths, daily life can be taxing. Social settings, like parties or workplaces, may feel like navigating a minefield of unspoken rules. Misunderstandings in conversations can lead to feelings of isolation. Sensory overload, say from a crowded mall, can cause anxiety or meltdowns. Masking, where individuals hide their autistic traits to fit in, is exhausting and can impact mental health. School or work environments may not always accommodate their needs, like preferring quiet spaces. These challenges don't define them, but they highlight the importance of understanding and support from family, friends, and communities. Masking is a coping mechanism where autistic individuals mimic neurotypical behaviors to blend in. It's like wearing a social costume, smiling on cue, forcing eye contact, or suppressing stimming. While masking helps navigate social settings, it comes at a cost. Studies, like those cited by Verywell Health, show it's more common in females, contributing to underdiagnosis. Masking can lead to burnout, anxiety, or depression because it's mentally draining to constantly perform. Imagine acting in a play 24/7 without a script. Recognizing and reducing masking can empower individuals to embrace their authentic selves, but it requires a supportive environment. Early intervention is key for mild autism. Social skills training helps individuals navigate conversations and build relationships. Applied behavior analysis, ABA, though controversial, aims to reinforce desired behaviors, but critics argue it can feel coercive. Communication skills training addresses challenges like understanding tone or expressing needs. Occupational therapy can help with sensory sensitivities, teaching strategies to cope with overwhelming stimuli. The goal is personalized support tailored to the individual's unique needs. Therapy isn't about fixing autism, but about equipping individuals with tools to thrive in a neurotypical world. Catching mild autism early can make a huge difference. The MCHAT-R-F, used for toddlers aged 16 to 30 months, screens for early signs. Early detection allows for timely interventions, which can improve social and communication skills before challenges become ingrained. However, because mild autism traits are subtle, they're often overlooked, especially in girls. Parents and educators play a critical role in noticing signs like difficulty making friends or intense interests. Regular developmental checkups are vital as they provide opportunities to identify traits that might otherwise be dismissed as quirks. Many with mild autism live independently, holding jobs, forming relationships, and pursuing passion. However, independence doesn't mean easy. They might need accommodations like flexible work hours or sensory-friendly spaces. Some benefit from ongoing therapy to manage social or sensory challenges. Technology, like noise-canceling headphones or communication apps, can be a game changer. Success stories abound, like autistic authors, scientists, or artists who show that mild autism doesn't limit potential. With the right support, individuals can lead fulfilling, self-directed lives, proving that autism is just one part of who they are. Ever heard of the broader autism phenotype, BAP? It describes people with subclinical autistic traits. Think parents or siblings of autistic individuals who share some characteristics, like social awkwardness or intense interests, but don't meet diagnostic criteria. BAP is controversial, as some see it as pathologizing normal variation, while others view it as part of the neurodiversity spectrum. Tools like the Broad Autism Phenotype Questionnaire help identify these traits. Understanding BAP can shed light on family dynamics and highlight how autistic traits exist on a continuum, even in those without a diagnosis. Mild autism is often misunderstood. Some assume it's not real autism or that individuals can outgrow it. Others think they don't need support because they seem normal. These misconceptions fuel stigma, making it harder for individuals to seek help or be themselves. Autism isn't something to cure, it's a way of being. Vaccines, a common myth, don't cause autism. Decades of research debunk this. Education is key to dismantling stereotypes and fostering acceptance. By sharing accurate information, we can create a world where autistic individuals are valued for who they are, not judged for their differences. If someone you love has mild autism, how can you help? Start by listening and learning about their experiences. Small accommodations, like reducing sensory overload or being patient during conversations, go a long way. Encourage their strengths. Maybe they're a whiz at puzzles or have an encyclopedic knowledge of a topic. Advocate for them in schools or workplaces to ensure they get the support they need. Most importantly, accept them as they are. Autism isn't a flaw. It's a unique lens through which they see the world. Your support can make all the difference. What's next for autism awareness? The neurodiversity movement is gaining traction, emphasizing that autism is a natural variation of human experience, not a disorder to fix. Research continues to explore genetic and environmental factors, though no single cause exists. Schools and workplaces are slowly becoming more inclusive, with sensory-friendly spaces and flexible policies. But there's work to be done: better diagnostic tools, more equitable access to therapies, and greater public understanding. By amplifying autistic voices and challenging stigma, we can build a future where everyone is celebrated for their unique contributions. Wow, what a journey. We've explored the world of mild autism, from its signs and strengths to the challenges and supports that shape lives. Autism is a spectrum, and every individual's story is unique. By understanding mild autism, we can foster acceptance and create environments where everyone thrives. If this video resonated with you, please give it a thumbs up, share it with friends, and subscribe to our channel for more educational content. Drop a comment below, tell us your thoughts, or share your experiences. Together, we can spread awareness and make a difference. Thank you for watching, and we'll see you next time.